Hi, good evening. My name is Madeline Pinedo. Today I'm going to be conducting an interview/podcast with my dad, who will be joining me in a very short moment. But first, I do want to explain what this podcast means to me. So I know that there's vast landscapes of global healthcare systems. Colombia stands out as a unique case, often overshadowed by more prominent nations in discussing about healthcare. However, the intricacies of Colombia's healthcare system and its challenges warrant attention and exploration. This podcast will aim to shed light on the Colombian healthcare system for an audience that may have little to no knowledge about it, particularly individuals who may not typically seek out information about international affairs or healthcare systems outside of their own country. This podcast means so much to me as I have grown up in America, but primarily all of my family lives in Colombia as my dad was born and raised there. So I often frequent the beautiful country that is Colombia. And so I can't speak on the fact of growing up in a system like that, but I am so excited to bring my dad on and just let him understand or help me understand a lot more about what we don't see on a daily basis. A lot of people my age don't have the same background to be able to experience the hardships that are faced with a lot of medical issues in different countries. And so I've had the unique experience through COVID and through, just the years after of what my family's faced. And unfortunately, there's been a few hardships and it's been pretty hard navigating through those. And I just wanted to get a perspective of my dad because he obviously is in America, but it's very deeming that there's people that he grew up with and his whole family is in a totally different country and he can't do anything about it. And so it's very inspiring to me to talk to him, and I wanted to share that with y'all. I'm going to conduct this as if it's an interview because he gets a little shy with speaking into a device for a podcast. So here we are, and I'll introduce you to him. Join with my dad. And what's your name?
Pedro Pinedo.
Okay, for my first question, what is your significance to knowing about Colombia's healthcare?
Well, I am a Colombian citizen as well as a U.S. citizen, and I grew up with the normal healthcare system. When I say normal, I refer to the same health system that we currently have in the United States.
Okay, for my next question, simply explain your stance on what Petro is doing to change about the healthcare system.
Well, when I was growing up in Colombia, I was a mid-class family, coming from a mid-class family, I should say. And of course, the healthcare system was privately, and we had to pay for the healthcare. And it was working fine, just like the way it works here in the United States. When the current president started his period in the government, he basically converted the healthcare system to socialized, which means that that mid-class to upper class have to pay for the low-income families to be able to have healthcare. In the meantime, it becomes very difficult when somebody gets diagnosed with some sort of disease or sickness, and once they prescribe the drugs that person needs to overcome the situation, they don't approve them. So that's my view about what has changed so far.
Okay, for my next question, who is in your life that is being affected by the ever-changing healthcare system?
I currently have an older brother that has been diagnosed with some disease that needs special treatment and special drugs, and it has become a problem every time that the doctor diagnoses certain treatment or certain drugs, because they are not approved by the healthcare system. So you have to basically hire a lawyer to pursue the situation in able to get prescribed those drugs. Otherwise, you will have to pay them out of pocket, and they are extremely expensive.
And how does this make you feel?
It makes me feel very powerless in the sense that people are paying for the healthcare system along with somebody else somebody else's healthcare system, and and they're not getting what they're deserving to get. So it's very frustrating.
Okay, for my next question, why do you think other citizens view this issue differently?
I think they view it differently because, like I said on the previous questions, low-income families, they're able to use the healthcare system to their advantage because they are getting approved for the drugs that they need to be able to overcome any disease or sickness that they have, when the other people that are paying the majority of the money to contribute to the healthcare system are having troubles getting the medicine that they require to be healthy.
Okay, last and certainly not least, what is something that can be appreciated on both supporting and opposing sides of this issue?
I believe something that can be appreciated is if the healthcare system starts treating low-income people, mid-class and upper class the same, in the sense that when somebody, especially mid-class, is in need to get certain drugs, they can get us approved as rapidly as the low-income families are getting it. After all, the people that are contributing the majority of the money for the low-income families to be able to have health care.
Okay, that closes our interview. Thank you so much, Dad.
You are very welcome, my dear.
So this is the time when I do my closing out. I hope that whoever's watching really enjoyed that interview and it created a different outlook on a system that we don't usually see. But with that being said, I created these questions that I asked my dad very carefully based on other people's opinions and what's been written about this type of system. One of the questions I asked my dad is, why do you think other citizens view this issue differently? And that was kind of hard for him to figure out, and I think that kind of directly portrayed what other people in Colombia think of the system and how they've been handling it. He took a while to answer that question because he's been so set in his ways, and it creates a different question for the people who are experiencing this to have a different outlook. And I thought that was very interesting because this is something that's affected him all his life, and it created a different perspective. And so now I urge you as a listener to listen to these podcasts or things like this, or read the articles that make you think differently. So I've linked 2 in the description of this podcast, and the first one is called Colombians Take to the Streets in Favor of Healthcare Reforms, and that's written by an anonymous writer in order to create a stance on an issue that they think should be changing, and they are in favor of this. And then for a counter argument that you may want to look into to see where your opinion forms is an article labeled, "In Colombia, a well-oiled healthcare system is at risk," insinuating that they're against what is being changed and what is happening. And this is written by Andrea Jaramillo, I hope I'm pronouncing that right, and Oscar Medina. And so this created a different perspective for me as a learner in this subject, and even my dad, because he had been used to this whole perspective that changed after today, and it taught him how to see things differently. So I urge you as a listener to figure out your own stance on this, and I hope that this podcast kind of helped a little bit to have an insight of somebody who was experiencing all of this. But do your research, and these were mine that I did my research based off of, and it was very interesting seeing the different types of point of views. So I hope that you take that away as well, and that's going to be all for my podcast. Thank you for listening.